I'm Don. I'm from Canmore, Alberta, Canada, and I'm a snowbird Arizona for the last 10 years. I'm 80 years old, and I've had some problems with the knees and coming down here, not because I came down here, but as age went on. I used to ski a lot, and I realized that skis got faster and my brakes got older, so I had to do something to repair, and that's being the knee. I went and talked to a knee surgeon, and it was a total complete replacement is what they thought it would be. They showed me a video as to how they do it, and that was that was my first little concern. And secondly was a big concern of infection. I had a friend of mine that got infection by getting a knee done, and it's a big recovery time, and I know that some people have been very successful with it, but I know some other people that have not been that successful. So I looked for stem cell, and I found Dr. Fisher here, which we had injection last year, and it worked out very favorable for me. The first thing that when we started to construct a path of reconstruction was that we went and had an MRI. So we went down, had an MRI, and then that results came back in a short period of time, and then he called me and then came in and told me exactly what the situation would be. Then we had the procedure, which was, I don't know for sure, but I think probably maybe an hour and a half from the time I came in to the time I got out. And then I went back to our house, our home there, and just kind of took it easy for a couple of days. And as the stiffness and the swelling went down on it, and he said, make sure that you don't be non-active, be active with it, keep it moving, which I did. And then I think I came back in maybe 2 weeks later to re-examine it, and he was very pleased and happy with the procedure as it went along. I was a little apprehensive about it when it first started, but then as it went on, I have to say that I've had no pain whatsoever at night with my knee. I generally golf maybe 3 times a week. I have no ill effects from that whatsoever. And also I walk probably 10 steps or 10,000 steps a day. I religiously go to the gym 2 to 3 times a week and work my knees and legs, and I think it's so important to work the muscles around the knee. I feel pretty happy with it. I certainly have no problem in recommending Dr. Fisher to his patients, and he certainly tells you as it is. And I've been very fortunate at my age that I can do the things I can without having to go into knee surgery, which I kind of dreaded. I had a lot of friends who have done that, but it takes you out of commission for a few months, and there's other areas of danger that are in there, such as infection, etc. I would certainly suggest to go and see Dr. Fisher, and he can evaluate it. He's very straightforward, and he tell you whether it's good for you or not. And if he feels that it will work for you, then he will do it. If he feels it will not work for you, he will not do it.